All right, now we have some great speakers from HCAI talking about social and community impact with data. We're having to have them walk to the stage, Mike Valley, Deputy Director and CIO, and Tamara Simajek, I think I said that right, Simajek, Chief Planning Officer and Branch Chief. Welcome to the Data Expo.
John, thanks so much.
Got it.
And 10 years of Data Expos, and as this one comes to a close, if I can take the liberty to say that I think this is the best one yet, without a doubt, and that this CalHHS data community is stronger than ever. So thank you all so much for being a part of this and for spending your time with us. Again, Michael Valley, Deputy Director, HCAI.
Tara Zamanjic, Chief Planning Officer, Branch Chief over our Planning and Management Branch.
And in the spirit of partnership, I wanted to shout out someone in the room, HCAI's Chief Equity Officer, Elia Gallardo. She's sitting back there. And just to say, everything that we're doing could not be possible without her leadership and working so closely together. So just thank you so much, Elia, for all that you do. The California Department of Healthcare Access and Information, as you may know, has a long and storied history of supporting informed decisions through evidence-based analysis and data, beginning with disclosures and transparency of hospital financial information beginning in the 1970s. HCAI then implemented the state's hospital discharge database in the 1980s. In the early 2000s, we began outcomes reporting for hospital procedures, and since that time, cardiovascular outcome surgery mortality has decreased by over 20% over that 20-year period. In 2018, we implemented the first state prescription drug cost transparency program, and last year we implemented the healthcare payments database, California's all-payer claims database. But some of the most exciting data programs that we're working on and have been engaged on in the past several years are focused on the areas of health equity and social impact. These include monitoring and targeting community benefit investments nonprofit hospitals make at the local level to justify their exempt tax status, encouraging hospitals to contract with diverse-owned businesses to expand opportunities for historically disadvantaged groups, expanding access to discounts on hospital bills for economically disadvantaged patients, and the Hospital Equity Measures Program we will be highlighting for you today. We're excited to present to you a hospital equity data toolkit working in direct collaboration with our diverse community of stakeholders and experts representing the entire state, and which we hope will help healthcare providers work across sectors to advance health equity and to be a template for other such data equity initiatives. Excited to hear your feedback about this, excited to hear your thoughts, excited to hear how we can partner together. With that, I'll turn it to Tara to jump in.
Thanks, Mike. So I'm going to first start talking a little bit about our social and community impact with data portfolio. This portfolio of data programs provides insights on health quality outcomes as well as hospital engagement in the communities. I provide two examples here on the slide. So on the left-hand side, we have our visualization of social drivers of health and preventable hospitalizations. It shows preventable hospitalizations by race and ethnicity and allows data users to cross-examine those with certain social drivers of health, including employment, home ownership, and access to parks. One of the key findings that we found out of this data set was that Black Californians had the highest rates of potentially preventable hospitalizations. This kind of information is something that the healthcare system can utilize to develop more targeted interventions for this population to reduce this disparity. On the right-hand side, you have an example of our hospital supplier diversity program that Mike had mentioned earlier. That program looks at hospitals' investments with their diverse suppliers. Our data shows the vast ways that hospitals differ in how much they spend with diverse suppliers, what their outreach activities are, and whether or not they require certification. That kind of data can be used by diverse suppliers who are looking to target specific hospitals, as well as by policymakers who are looking to hold hospitals more accountable for their engagement with the communities. So our most recent addition to the social and community impact with data portfolio is, as Mike mentioned, the Hospital Equity Measures Reporting Program. So this program builds on quality improvement and equity initiatives that hospitals are already undertaking. It requires hospitals to report on and stratify a set of quality measures that were selected in partnership with stakeholders. And once they've kind of analyzed their data, they're required to identify the top 10 disparities in their data and develop a health equity action plan to address those disparities. Those plans, along with their analysis, are then published on the HCAI website, or I should say going to be published on the HCAI website. We haven't gotten the data quite yet, and will allow members of the public to enable greater public transparency and engagement, in turn holding hospitals accountable to those quality improvement and equity initiatives that they're working on. So why talk about hospitals, health equity, and data? Hospitals have a broad impact on the communities that they serve, and disparities occur at many components, at many kind of parts here. You can have disparities in the community prior to hospitalization. You can have disparities during hospitalization, as well as disparities after hospitalization. And it's through looking at data that hospitals are able to identify where in this process the disparity is occurring and which population it's impacting. Because that's the way to develop really targeted intervention. Because if you think about it, if you have a disparity in patient experience for a population of non-English speakers, that intervention is going to look really different than if you're trying to address a disparity for hospital readmissions in the LGBTQ population, for example. However, in order to be able to do those targeted interventions and develop actionable equity plans, hospitals need to have quality, complete data on their patient demographics as well as on their health-related social needs. And one of the first things that we heard as we were talking to hospitals and learning about, starting to implement this program was that hospitals don't collect sexual orientation, gender identity data. They don't collect disability status data. And much of their race, ethnicity, and language data might have an other or an unknown value, which at the end of the day makes the data much less actionable. So we came to our committee, our group of stakeholders. We have the privilege of working with a really incredible group of stakeholders that are listed here on the slide and really represent hospitals, vulnerable populations, advocacy groups, as well as health equity measure experts. And we came to them with this issue, and they were like, yep, that's true. That is what we know as well. Hospitals aren't collecting this information right now. But through the implementation of this program, we have an opportunity to move the needle on that work. There are resources out there that exist that can help hospitals develop those data collection processes. They just need to know about them. And moreover, it's not just about collecting the data, but it's about training the hospital staff to understand the best practices around explaining to patients why this data is being collected, ensuring the patients are able to self-report the data, because we know that that's the best way to get this kind of data, as well as ensuring there's accessibility for different language and disability status needs. So in partnership with our committee, we set out to build this hospital equity toolkit. So the toolkit's available on our website. You can access it at hcai.ca.gov/toolkit. And it outlines 3 tools that hospitals and other healthcare entities can utilize to leverage improving equity in healthcare, as well as participating in our hospital equity measures program. So there are 3 buckets that we're going to be covering: data collection, health-related social needs, and health equity planning. The data collection set of tools provides best practices around the collection of race, ethnicity, and language data, sexual orientation, gender identity, and disability status data, looking at it through a lens of cultural sensitivity and patient-centeredness, all the while protecting patient privacy. We, of course, link the CalHHS data de-identification guidelines as a key resource as a part of this tool. Moving on to the health-related social needs, this section covers best practices for clinicians to have conversations with their patients around food insecurity, transportation, housing issues, and potentially issues around interpersonal violence. Helping to explain to patients why they're being asked those questions as a part of their medical visit, as well as helping clinicians think about what are the most effective interventions to support patients as they do discharge planning. And then finally, the health equity planning piece provides tools around making sense of the data. How, when you discover these disparities in your data, are you able to develop an actionable plan that can be iterated upon and monitored as time goes on? And as I mentioned, these resources already existed out there. We didn't need to create any of these resources. It really was around looking at what was out there and then bringing it all together to be able to be found in one easy spot. So these resources come from various organizations from across the country. They include both public and private organizations, hospitals, and advocacy groups, as well as state and federal government organizations. And our committee reviewed and vetted these resources, added some of their own, and have helped us continue to further refine this toolkit. And before I turn it over to Mike to close us out, I just want to leave you with kind of what some of our goals of developing this hospital equity toolkit are. So first and foremost, it's building awareness. We want to make sure that hospitals are aware of these resources and best practices for when they're starting to build these data collection practices in their institutions. Secondly, we want to see them utilizing these resources, and the way that we can sort of monitor that is looking at our hospital equity reports and hoping that we start to see more complete data as well as more comprehensive health equity action plans. And then ultimately, the goal is to really drive change, hoping that through the data collection, through the development of these health equity action plans, hospitals are able to reduce disparities and deliver more targeted care to California's most vulnerable populations. I'll turn it back over to Mike to close us out.
Thanks, Tara. Some lessons learned from this work and key takeaways. First, engaging diverse stakeholders, and Tara mentioned the committee that we're working with. Nothing about us without us. It's an all-in effort, and we're just thankful to have such an engaged group working directly with HCAI and helping us, holding us accountable too, so that we can refine what we're doing and be responsive to communities' needs. Next, adopting standards. Standardization is innovation. Standardization is a form of innovation. There's so much going on in this space, as was said, building up from what others have already started. Aligning measures and other efforts is important. Next, leveraging resources that are already in place. As government, we should be effective, we should be efficient, we should minimize administrative burden on the healthcare system where we can to not drive up costs. We should minimize burden and the time tax for patients and families as well. And then finally, considering the end goal, keeping that in mind, what behavior changes do we seek, either from systems or individuals? How can data be targeted to drive that change? And how can transparency produce public engagement and produce the shared accountability that we're looking for? Just a few lessons learned at this point. We're going to keep learning. Check out the toolkit, hci.ca.gov/toolkit. Provide us your feedback. Leverage this for your own work, and continue to use data to drive action and partner with all of us. So on behalf of Tara and of HCAI, thank you so much, and thank you for a fantastic program today.
Really fun.
Thank you so much.
Thanks all.
You wrap it up.